You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. My first guest is Dr. Roland Estrabillo. Dr. Estrabillo, welcome to the program.
Randy, thank you for the invite, and it's a pleasure to be here.
Now, before we get into today's topic, tell us a little bit about your practice. I guess you have two practices.
Yes, I do. And well, I have a general practice in Hamilton for 21 years now. And about 19 years ago, I started getting into the dental implants.
So this is, I mean, your goal is to focus exclusively on dental implants. Is that right?
Dental implants and cosmetic dentistry.
Now, why do you like dental implants so much? You say, in all areas of dentistry, probably the happiest group of patients. Why?
That's because I find that patients are very appreciative, and also it's very rewarding. It is a very life-changing experience.
How so? How so? You say you're changing somebody's life.
Well, changing lives in a way that a person would come in with a denture that's loose. Okay. They cannot eat really well. They don't have the confidence socially. And when you put just even 2 dental implants in there.
So 2 implants can do what? Secure
that denture so well that their self-confidence skyrockets.
Okay.
Their ability to chew their food, it's just improved tremendously. And I do believe that if they're able to chew their food better than before, their health will improve as well.
Is this one of those things where the patients, let's say the denture where they say, I should have done this years ago?
Oh, I hear that so many times. How come nobody has told me before? Okay, it's just now that a patient would come in, okay, even with the least amount of bone, it is possible to secure that denture with 2 implants.
Okay.
So that they'll be so comfortable.
So what has changed in the last 20 years when it comes to dental implants? We've talked a little bit off camera, and you say in the last 20 years, huge changes, makes it a lot easier on the patients.
One of the biggest changes there is actually in dental implants is their implant design. People that used to think that they can't have dental implant because they're osteoporotic, they have a softer bone. With the new design on dental implants, the predictability or the success of dental implants on those kind of people is improved.
So they don't fall out?
Well, they're safer than before. Not necessarily fall out 100%, but majority of them, because of this new threading, for example.
The bone just holds right onto it? The bone
holds right onto it.
So, okay, so 98% of the time, 97, 98%, you say that the procedure is successful?
Yes.
Nationwide?
Yes.
What else has changed?
What else has changed is the technology. The implementation of a new dental CT scan.
So a CT scan?
CT scan has allowed clinicians to actually do a virtual surgery before they actually get into their clients. So they have predictability. They know exactly where they're going to put the implants, what kind of bone there is that they're going into, and where the anatomical landmarks such as the nerves and the sinus are.
So the imaging just allows you to be more precise?
It allows you to be more precise, and also it allows you to decrease your downtime. See, what happens when you're going in there knowing exactly where you're going to put that implant, how it's going to sit safely in that bone and close to that nerve or sinus,
okay,
then the danger is totally minimized as far as the patient is concerned. And also there's one thing that's really important. Because the clinician knows exactly where he's going, the surgical procedure is actually less complicated than before.
So you can, in certain cases, for a denture wear, let's say,
yeah,
in one day, give them something that's fixed in their mouth. Is that accurate for the right candidate?
For the right candidate, it's accurate. If they actually meet the requirement, the toughness of the bone, you could actually put that implant in their jawbone, and if that implant is torqued or tightened enough, it is possible for that client to come home with their denture fixed in their mouth.